All right. So with this chapter, we're going to go over the multicultural counseling theory and discuss the PowerPoint that was presented to you in Moodle by the authors of your text. And I figured that it would be easier to just look at this PowerPoint that they created because it goes over everything fairly easily. So you don't have to look through multiple PowerPoints. So with the objectives, we're going to go through the core counseling theoretical groupings, the history of counseling theory, the multicultural counseling theory, look at their case conceptualizations in your book that we're not going to go through, but we'll look through the individuals who helped create multicultural counseling theory. We'll look at the meta-theoretical nature of multicultural counseling theory. We'll also look at the modalities used within this framework, the multicultural framework, and then theoretical techniques, and then also some limitations. And then again, look through this PowerPoint on your own as you read through the text. If there's anything that we missed that you thought was important, definitely, or is important, bring it up in class and we can definitely talk about it. So with the four forces of psychotherapy, there being psychoanalysis, behavioralism, humanistic, existential, and multicultural counseling. So with multicultural counseling being one of the four forces, it allows us to understand that multicultural counseling needs to be applied in how we conceptualize cases and how we process and understand individuals and their own social and cultural identities within the therapeutic process, as well as understanding our own social and cultural identities. And also too, that it's really important to understand as well that multicultural counseling is embedded within the context of this profession, whether it's in ethics, CACREP, programming, accreditations, all that good stuff. So multicultural counseling theory is rooted in understanding inequalities that influence the counseling process and the cultural level disparities that are experienced by communities of color in the form of any sort of discrimination, marginalization, oppression, exclusion, and diversity among clients and professionals continuously evolve, like meaning that as the world changes, these theories will change with it. So the five practitioners listed in your text in this chapter all contribute to the formation of multicultural counseling theory. And it might be a little confusing because you might think like, is there just one person that made the theory up? No, they all contribute to it. Like for example, Sue created the multicultural counseling as a theory. Dr. Von Tress focused on cross-cultural. Dr. Arredondo focused on multicultural competencies and so on. So they all contributed different things with that theme of multicultural counseling. And then the therapeutic interventions were developed using an emic and an etic approach. And that really just looks at intersecting identities. And an etic approach explores culture from a universal perspective, while an emic explores culture from a specific view of cultural groups. So, for example, etic assumes behavior patterns are universal, whereas emic assumes behavior patterns are unique to a culture, right? It's like from an outside perspective versus an inside perspective. And with understanding these approaches as counselors, we're able to provide cultural sensitivity and appropriate counseling tailored to that individual needs and experiences. So as you look through your text, you'll see these five practitioners that we named. I named a couple of them at the beginning. And I'm going to go through, just do a little overview of all of them and how they contributed to this specific theory. So with Dr. Von Tress, they focused on cross-cultural counseling. And with his work, he wrote extensively on what it means to be human, cross-cultural counseling competencies, and the interpersonal and intrapersonal experiences of Black men, and an existential theory. And much of his work and literature in multicultural counseling movement was centered around that piece of taking culture into consideration within the therapeutic process. So specifically with the cross-cultural elements, he explained that it is the counselor's responsibility, and this is his quote, to break through cultural barriers, meaning that he placed great emphasis on relationship building therapeutic techniques. And we've previously talked about the importance of the relationship or that therapeutic alliance. And with Dr. Von Tress being an existential counselor, it means that he, if you look ahead and refer to your text, explored the topic of meaning, freedom, responsibility, anxiety, guilt, loneliness, death, the body, the lived experience, all those things. I mean, he also embraced ambiguity and affirmed the mystery of existence as a whole, and especially the mystery of existence among diverse populations. It can be very confusing if you're not an existential person. Um, and then Dr. Sue, which is my personal favorite, one of my personal favorites, when it comes to multicultural counseling, they, along with, the colleagues that helped them with this, created the multicultural counseling competencies, which many researchers within the field use to create or expand on their own formation of some sort of multicultural and social justice competencies. You learn that you'll learn about this in your multicultural counseling class that you eventually take. So I don't want to go too much into it so it won't be repetitive. So Sue and colleagues developed the multicultural competency model, and it highlighted three dimensions of cultural competency. The first dimension is being aware of your own values, beliefs, worldviews, and limitations that might impact your work with culturally different clients. So specifically paying attention to the impact that you might have on your work with racially, ethnically, or otherwise clinically different clients. And then the second piece being making a genuine effort to understand that clients' values, beliefs, and worldviews and how those impact their life. And the counselor's approach in this, and here are these skills, is to present yourself in a non-judgmental way and accept that client's worldview as a valid way of life. And then that third piece is possess the skills and interventions necessary for working with culturally different clients, as well as practicing them in your work with a particular client. I do think it's important to keep in mind that Sue created these things back in the late 80s, 1982, even was some of the dates on their work. And he wrote about these things in that time. So take into consideration what was going on for an Asian man in 1982 or a minority person in general in 1982. Not saying that it was as bad as what went on in the 60s, but take that into consideration when trying to understand and apply these theories. And it's interesting because 1982 versus 2022, we see a lot of similar things going on related to culture. And Dr. Helms focused on racially and ethnic identity development. So you do yourself a disservice when you don't explore your own identity development, whatever that is. And Helm consistently focused on the importance of bringing awareness to race and ethnicity when it comes to human development. It's important to understand the societal conflicts associated with race and culture when it comes to thinking about society at large with the mental health, education, business, etc. And all of these things affect your identity development. And it also takes a certain level of self-awareness to explore these things as patients and counselors. Dr. Arredondo focused on multicultural competencies as well. And Dr. Arredondo created culturally appropriate interventions and techniques. So she created these interventions and techniques with the notion that culturally skilled counselors are aware of institutional barriers that prevent minorities from using mental health services. So counselors also should be able to identify and communicate alternatives to reduce or even eliminate those barriers within their own institution, whether it's state, local, national, macro, micro. This goes into that leadership and advocacy piece that counselors often engage in. And she also created the personal dimensions of identity model, which focus on intersectional elements of individual and group identities. The three interacting dimensions are age, culture, gender, race, sexual orientation. That's dimension one. And then dimension two would include educational barriers, beliefs, spirituality, religion, location. And then dimension three, or dimension C, would focus on historical moments or different things that happen throughout the world history. And this model can provide a framework for interpretation of a client's presenting problems, because dimension one, which focus on those stereotypes, assumptions, and judgments, and dimension C regarding the historical or social political events, are considered, consequential of dimension C or dimension B, meaning that the assumptions, stereotype, judgment mixed with the historical moments and eras of that cultural background can influence whether or not a person is able to receive proper health care, have work, any of those things. And all of these things are to be considered within the therapeutic relationship, and they all play a role. All right, and these aspects cannot be ignored. So if you think about, for example, African-American folks, if we're thinking about race, that dimension one, race, social class, sexual orientation, you have a Black LGBTQ member, low socioeconomic status individual come into your office, you take into consideration historical racism, also their intersection of those marginalized identities, and how it affects their ability to get any sort of healthcare, any sort of mental health services, housing, all those things affecting their mental health in general. And then lastly, Dr. Peterson focused on cultural biases and the cross-cultural movement and counseling profession, multiculturalism as the fourth force in counseling and psychotherapies. And he also emphasized that behaviors are and thoughts are learned in specific cultural contexts, and that everyone has cultural teachers. And then when we talk about the meta-theoretical nature of multicultural counseling theory, the multicultural counseling theory is a framework for counselors that encourage the consideration of multiple modalities while creating treatment goals that align with life experiences and cultural values. That is a quote from your text on page 43, which stands out because we previously talked about this idea of being eclectic or integrative when it comes to theories, and how it's important to work from one or two theories that you most relate to. And as you develop your own counseling identity, it's important to explore various approaches in the therapeutic process, but also aim to be purposeful when considering yourself and the client, because you both have multiple cultural identities. And in your text on page 44, it says that multicultural counseling theory is an interplay between interpersonal, intrapersonal, and systemic. And a little refresher, that the main difference between interpersonal and intrapersonal communication is that interpersonal is between two or more people, and intrapersonal is between you and yourself. So if we look at risk levels of mental health problems, we have to look at the cultural identity and the number of systemic barriers that a patient might face, and that can help you understand which intervention, treatment, considerations, case conceptualizations to apply when you consider the entire person. And then the tenets of multicultural counseling theory, it starts with dismantling the systemic exclusion. So this looks at historically oppressed cultural groups who have been marginalized or excluded from ethical care, which affects their experiences in life in general. The second tenet looks at the awareness of the limitations of current counseling training. So this looks at the limitations across counseling training programs when it comes to implementing cultural sensitive treatment modalities. And hence why it's like plastered all over CACREP, whether in a master's program or a doc program, about multicultural competence embedded in each class you teach, basically. The third tenet looks at multicultural counseling is essential for treating the whole client. So this piece goes into applying this theory as a method of comprehensive treatment, but also integrating other theories. And then the modalities used within a multicultural framework. So there are a few modalities explored in this chapter. I already talked about the personal dimensions of identity earlier, but just a quick overview of these. The racial and cultural identity development model is a 5-stage developmental model that helps counselors conceptualize and process clients' experience of racial and cultural identities. So according to this model, since racialized identity is the root of what contributes to experiences of marginalized and oppressed individuals, it is important to create a sense of self that is fulfilling and integrative. With that, the counselor structures questions for gathering information in order to understand the client's level of conformity with the dominant culture, as well as any sort of rejection that they might have against their own culture. And circling back to that piece of identity, you can take time to read through the stages of this model, but keep in mind that these stages are nonlinear and that they're based on the client's sense of cultural appreciation and or devaluation. So whether they accept or neglect their own culture or that of the majority culture. And then the ecological model of multicultural counseling psychology processes, that EMMCPP. This model was created as an integrative framework, and it integrates ecological and multicultural factors, meaning that a person has an impact on their environment, and then the environment impacts the person as well. So this model allows for clinical perspective, treatment planning, and case conceptualization to address socio-cultural factors. How does the client experience within the system affects them, within their system? So within the model, it would be wise to refer to the multicultural and social justice competencies practice. Again, something you'll see in your multicultural class. This model seems to place great emphasis on the intersectionality and viewing the client as a system. And then the NTU therapy is a training model used for African-American population. And this one takes the principles of Kwanzaa. I don't know if anybody's too familiar with Kwanzaa. And Kwanzaa is an African-American holiday where 7 principles are shared between December 26th and January 1st. And within these principles, you create like an action plan to achieve that principle of the day. And the principles include things like unity, self-determination, purpose, creativity, and more. The multidimensional model of broaching behavior. Now, this model focuses on addressing cultural and social political factors within a counseling session. And this consists of the counselor demonstrating a genuine openness for discussion of issues related to diversity and culture within the therapeutic relationship. Broaching is something you'll hear about within your program because technically it's the counselor's responsibility to broach these things. And broaching is studied as a clinical tool for counselors. And counselors are able to provide that open, non-judgmental space for clients to examine issues of race, culture, power, and a variety of marginalization in session. And with appropriate broaching, counselors carve out that safe space and that therapeutic relationship so that these challenging conversations can be held due to the fact that they play a role in the client's experience. And keyword is challenging conversations, both challenging for you and the client. So lastly, relational cultural theory. The relational cultural theory basically says that throughout life, humans grow through and towards connections. With relational cultural theory, counselors explore ways to develop and maintain connections. On page 42, or not 42, 52 and 53, you'll see the tenets of the relational cultural theory and its goals within therapy. Now, the intersecting layers of MCT, multicultural counseling theory. So the intersection layers of multicultural counseling theory listed on this slide recognize that the 3 frameworks that counselors should understand and apply. And again, I don't want to go over the multicultural and social justice competencies too much because you'll learn that in your multicultural class. But as previously stated, the multicultural and social justice competencies Counseling competencies came from Sue's multicultural social justice competency framework. So, excuse me, so Sue created this framework and then people just, expand on it. So the counselor is encouraged to have a significant level of awareness, knowledge, and skill that support the client's individual and group social and cultural identities. And this framework also looks at the intersecting identities of the SES, which is socioeconomic status, poor, rich, religion, sexuality, race. Advocacy is also rooted in this due to that action-oriented way to support the client. Um, counselor, the counselor advocate scholar model. This model was also created by the same individual who created the multicultural and social justice counseling competencies. Individual by the name of Ratz and peers, so he had some colleagues contribute to this. The counselor advocate scholar model suggests that the counseling role and the scholar role overlap where they serve each other, and then the counselor role and the advocate role both inform each other. It's an interrelationship between these roles. And the roles of counselor inform advocacy and scholarship. So what do you do next with the awareness in the skillful use of therapeutic tools to intentionally address issues of oppression, right? So it's a combination of the advocate, the counselor, and the scholar. And lastly, the theory of multicultural counseling, basically wrapping up everything that was previously discussed, the idea of questions used as intervention tools were emphasized in this section as well, because counselors who are aware of their own personal bias, ideas, stereotypes, all of that can gain trust with marginalized clients. You have the awareness to ask culturally relevant questions that can help the client process and encourage understanding through the change process and therapy. So specific theoretical techniques used in multicultural counseling theory. So the following three theoretical techniques and processes commonly used in the multicultural counseling theory would be affirmative intersectional counseling. Now, this approach recognizes the intersectionality of clients' identities and seeks to affirm and validate their experience. Also, the use of liberation psychology. This framework focuses on addressing systemic oppression and promoting social justice, and then empowerment psychology or empowerment counseling. And this approach emphasizes empowering the client to take control of their own lives and make positive changes. So these three theoretical techniques, affirmative intersectional counseling, liberation psychology, empowerment counseling, are the techniques and processes commonly used within this theory. And affirmative intersectional rehabilitation counseling, that AIRC is also a theoretical technique used in counseling for sexual minorities who have chronic illnesses. So when we think about marginalized populations, we have to think about more than just race and ethnicity. We want to think about disabilities, sexual orientation, all of those things, right? This AIRC integrates competencies from rehabilitation counseling, multicultural theory, and more. And then the empowerment counseling, this one aims to help clients strengthen their personal power and the building of resilience in the areas that may have been impacted by trauma and oppression. And then the four components of the empowerment counseling include that awareness, dialogue, psychoeducation, and processing, understanding how systemic and institutionalized oppression manifests in clients' lives, in all clients' lives who are in marginalized population. Again, not just race and ethnicity, but individuals of the LGBTQ community, disabled individuals, and so on. And this one is rooted in a humanistic approach, and they set goals that are self-actualizing and free. So looking through, this was the empowerment counseling. The last one they talked about was the eye care. And this technique is holistic and framed for intentional address of processing how to reduce the risk factors associated with poverty. So again, not just race and ethnicity, low SES would fall under marginalized population, low SES meaning low socioeconomic status. These risk factors associated with poverty are unstable employment and serious mental and physical illnesses. Again, this is that piece of advocacy that comes into play. Towards the end of this chapter, you'll see case studies. I encourage you to look through those case studies to understand how skills are demonstrated for that case when working with marginalized individuals. And also use the micro skills and the skills to help build rapport with clients, such as the OR skills, the open-ended questions, affirming, reflective listening, summarizing. Now, the last thing would be the multicultural counseling theory may be perceived as a standalone theoretical orientation. When it is not, that's one of the limitations. The multicultural counseling theory is difficult to frame with one set principle due to all of the contributors that we named earlier. But then all of these professionals, like we said, contribute to this theory and may have the same goal of increasing multicultural competence in clinicians in order to increase that awareness, understanding of working with marginalized populations. But they all achieve the same thing in different ways. And it's important to look through the other limitations that they have listed in your text. I didn't want to make this lecture too long. So look through, because every theory, it can have its limitations. So really look through your text and go over things that you feel like are important. Like I said at the beginning, present it in class with any questions, but this was just a basic overview of chapter, the multicultural chapter. And at the end, when we do our activity in class, you'll be presented with that case study that is in your text. I think it's named Bobby. Look through that if you'd like, or you can wait until we all are in class and look through it too. And we're going to see how it is working with in groups with that client and all of their issues. It's quite a long case study. All right, if you have any questions, please reach out.